Thanks, everyone, for joining today. This session is titled Partnering for Impact, How CBOs and MCOs Can Address Non-Medical Drivers of Health. Community First Health Plans and Latched have teamed up to offer pregnancy, parenting, and child safety support in San Antonio. In the last legislative session, HB 1575 aimed to improve maternal health outcomes by expanding NMDOH case management by doulas and community health workers. In response, managed care organizations are looking to community-based organizations to address these non-medical needs. This webinar will explore what CBOs need to know and do to build successful partnerships with MCOs. Our speakers today represent Community First Health Plans and Latched. Our Community First speaker is Jessica Rios. Jessica is the Director of Health Equity at Community First Health Plans. In her role, Jessica is currently working to lead their Health Equity Plus accreditation, and she leads the organization in data collection and creating strategies around removing social barriers for Community First members. Jessica has been with Community First for 2 years and received the Healthcare Innovation 40 Under 40 Award. Over to you, Jessica.
Thank you. So I know we're going to start sharing slides, but once again, my name is Jessica Rios. I am the Director of Health Equity here at Community First. While we're waiting for those slides to be shared, just wanted to say that it's really great to see so many different organizations here. So really excited to start this conversation. Next slide, please. So just kind of wanted to set the stage of who Community First is. We are a local health plan for those in Bexar County and the 7 surrounding counties. And so you'll see those counties here in the bottom left corner. We are in Bexar, which is probably our most urban county compared to all the others. You'll see Kendall, Comal, Guadalupe, Wilson, Atascosa, Medina, and Bandera County. We offer a number of lines of business or different plans within Community First. We serve over 200,000 lives and have over 4,000 practitioners here at Community First. Next slide, please. Yes, thank you. So I really kind of just wanted to set the stage, and talk about the importance of community partners. So managed care organizations and our partnerships really help improve delivery, access, and outcomes. So I've listed really 5 things. So although it is our hope as a community organization, and I'm sure as a practitioner, we really need the assistance of our community-based organizations to help us care for the holistic individual. As we get more into discussions with the state, CMS, we are really being held accountable. We as the MCO are being held accountable to care for members, not just their medical needs, but these non-medical and social needs. Again, our mission as the MCO is to provide health access for our members. And so the way and the best way to provide this holistic care is to utilize our partners in our local communities. So we address our community-based organizations address non-medical drivers of health. So CBOs help us reduce health disparities by tackling these non-medical barriers. They assist with cultural competency and trust. And so by being the heart of the communities that you serve or they serve, these CBOs, they've gained trust. They recognize the population, for example, the cultures, the race, the ethnicity that they serve, whether it's a small LGBTQ community that surrounds them. They know those communities inside out. They provide these wraparound services. So they specialize in providing support like nutrition programs, these housing assistance programs, transportation, mental health services, and more, just to name a few. They provide advocacy and education, right? So when the CBOs outreach to members, the intent is to educate community members in general and those in need of resources on health issues. They advocate for policies around these public health issues. And finally, linking to care, right? Community CBOs act as bridges between vulnerable populations and healthcare systems, really helping our members navigate a complex service. You know, I always use this analogy, but we have been on social media probably a couple of times today, right? Or texting. I'm sure most of us haven't called our local insurance today. So same with individuals who live in our community, and that's really what the CBO does. They're that bridge to helping gain that health access. Next slide, please. So why both matter and working together matters. So there are three reasons, right? An integrated integration of medical and social care. So MCOs focus on the medical care and the community-based organizations focus and address the social needs. Together, it really becomes a holistic approach, like I mentioned before, and that leads to improved outcomes. So we as an MCO, we have numerous metrics that we need to meet. I'm sure that you as providers, practitioners, clinicians, and all others need to meet, right? We have star and state ratings. We have member ratings. We have corrective action plans. We have process improvement plans that we need to do, and not to mention our own internal goals and KPIs. So partnering with a CBO is crucial for us to continue keeping our membership healthy and focusing on those who need additional navigation. There's only so many hours in the day, and so much of our budget can go to manpower. And that's the same for any organization across the board, nonprofit, for profit, education, clinical. There are just so many man hours and or manpower and hours in the day. And so we really need the help of others to carry our mission along and provide that holistic care for our members. There's a reduction in healthcare costs. So by addressing those issues like food insecurities, housing instabilities, CBOs help MCOs reduce costly health crises. So whether it's the state contractual obligations, new laws or bills into effect that come into effect, organizational priorities, the MCOs are always looking for help to reduce this healthcare spend and redirect those funds to our members in a more positive way. The last thing is the improved population health. Those joint efforts are for enhanced outreach, health education, and community empowerment. When we work with CBOs here at Community First, we really work on this messaging alignment, right? What are we as our health promotion and wellness team telling our members, and what is the organization that we partnered with, what are they telling our members, and how do we make our messages align? Could you imagine, you know, if we are all saying the same message and how powerful that is? Instead of affecting one person, you're affecting a whole community, and think how fast word spreads. So next slide, please. So I really quickly wanted to spotlight our community-based partner, Latch Support. I can't say enough great things about Veronica and her team over at Latched. We've been partnering together for 3+ years, and you know, this partnership started out very small, right? And very step by step, almost like a dating would. So we learned about services that Latch support provided, some of the members that we referred over there, and we started hearing really great things, right? Our members were getting the resource and the good that they need. And so to us and our team, that was all great. It was successful. We moved on into supporting events around doulas and community healthcare workers. More recently, we have the introduction of House Bill 1575, which came in last September, which we really found that Latch Support offered many items our pregnant members needed, both both goods, like tangible goods, and then general education. Those tangible things were diapers or education on babies' feeding and nutrition and so much more. Again, it's the messaging, it's those tangible things that make such an impact on our members. And so since last September, our partnership has grown and trusted with our community and with our staff here at Community First that we do not hesitate to refer members to them. Our MCO, you see the care partner provider, our care partner program. Our MCO is in the beginning stages or pilot stages of a program where we work with about 5 community partners and we are incentivizing them to provide care for our members, not only to provide care for our members, but to close the loop to show what is actually happening with those members. Did they receive the service? And if they did not, why? Was it because a case was resolved or they chose that they didn't need the service or what happened? Latched has been such a great partner in this way that, you know, Community First really thanks them for all that they've done. And so, once again, I just want to emphasize the importance of this collaboration and, all of these really powerful messaging that we are doing for our members through Latched. So thank you. With that, I'm going to turn it over to Veronica.
Thank you. Thank you. So good morning, everyone. My name is Veronica Simpkins. I'm the co-founder and co-executive director for Latch Support. And I'm excited to share with you how Latch Support has developed a meaningful partnership with managed care organizations, specifically our relationship that we have with Community First. And my goal is to help other community-based organizations think strategically about how to position themselves for similar opportunities. Next slide. So Latch Support is a nonprofit based in San Antonio, but our reach has gone throughout Texas because we offer virtual workshops as well as our out-of-town baby showers. We travel them to areas that we have identified as rural or maternal deserts that we think it's very important that those communities are getting that education. Our mission is to empower growing families through life-saving pregnancy and parenting education, provide essential resources and advocacy. So our work centers on ensuring that every child has a healthy start in life and every parent feels supported. Next slide. Our pregnancy program addresses the gap in maternal health outcomes by providing accessible education and support. So topics that are included within that education talk about having a healthy pregnancy, newborn care and safety, breastfeeding, postpartum care, and childbirth readiness. We know that we can provide, if we provide these 5 informed topics to women throughout their pregnancy, it will reduce complications and ensure families are well prepared before they deliver. Next slide. Our parenting program, it complements our pregnancy program and focusing on child development, positive parenting strategies, and really focusing on kinder readiness. We prioritize early learning and bonding through activities that encourage literacy, developmental play, and helping parents build strong foundations. We host monthly baby time and toddler times with a play-based curriculum, and we host a larger scale community event that we call our Little Learners Quarterly, where our goal is to also not only be a social space for families, but to build brand awareness for other families to learn about our programming. Next slide. Our car seat safety program is led by our certified child passenger safety technicians. We provide hands-on education and free car seats to families in need. This addresses both knowledge and financial barriers, helping families keep their children safe while they're traveling. Next slide. Through our material assistance program, we distribute diapers, wipes, clothing, food, and other essential items. This program responds to immediate family needs and serves as a client navigation within our other services. It's an important entry point for many of our clients because we have grown our organization to be a one-stop shop and have a lot of wraparound services, so we don't have to send our clients other places. Our community-based doula program supports birthing people through prenatal visits, labor support, and postpartum care. Our doulas come from the communities they serve, offering culturally aligned, high-impact support that improves birth outcomes and builds trust within healthcare systems. In addition to offering doula services to our clients, we also provide training opportunities for those interested in working as a doula. So our initial engagement with Community First began with tabling at their baby showers. And they host those baby showers specifically for their members. And we found them through a marketing post, and we emailed and we asked, would we be able to attend? And they extended that invitation. So our relationship first started with consistent presence with the invitation to the baby showers. And then it laid the groundwork for what future collaboration could look like. So they started noticing, as Jessica mentioned, that a lot of their members were engaging in our services, and we were able to share some of those positive feedbacks and really grow that credibility with Community First. Slide. So from there, our contact that we had at the baby shower, we asked if we could request a meeting to discuss more how we can be intentional together. That meeting led to Community First sponsoring 4 of our baby showers throughout the year, and Community First is a sponsored, is spotlighted as our sponsor at our baby shower, as well as on our social media platforms. So they allowed us to expand that capacity to reach more through also our baby showers. Next slide. Over time, that partnership continued to grow strategically. So Community First chose Latched to host their 50th food pantry on our campus. So this food pantry, it's been amazing for the community, one, and for Latch. But we struggle to keep it stocked because so many families are in need in our community. So it's open 24/7. Someone can just Google where's the nearest food pantry, and they have access to get food from that pantry. So that was a great, another extension to our partnership. Next slide. And then we were invited to pilot their Community First referral platform. And like Jessica mentioned, there was a incentive involved, but more than anything, it just showed a greater value for Latch to show Community First that we were operational ready and to serve their members with needs that they had. So we had systems in place already to how to manage referrals, how to follow up with clients, how do we track outcomes, and these are key traits that MCOs are looking for when you're starting partnerships. So our first quarter through the referral platform, we were able to close over 150 referrals, meaning that those members were referred to us and we were able to support them with whatever need they were referred for. Next slide. So this is a unique moment for CBOs right now. There's a lot happening as far as discussion around funding, but something to bring to CBO's attention if you aren't following is also Texas House Bill 1115. This bill allows CHWs and doulas to be reimbursed for the work many of us are already doing under their Case Management for Children and Pregnant Women program. But readiness is really, really important, and to make sure that you've positioned yourself to benefit from these changes. And why does this matter now? Because MCOs are increasingly held accountable for health outcomes, but beyond clinical care, a lot of CBOs that they can partner with are ready and already addressing those social determinants of health, housing, food, mental health, perinatal support. So that's where we come in. So community-based organizations, they have something that MCOs don't have, and that's that grassroots relationship. It's the deep community insight And it's the fact that we're already providing high touch points for cost-effective services. We know how to work on a lean budget to still meet those outcomes, to reduce risk and drive better health outcomes. Next slide. So what does it mean to be contract ready? Because contract ready can mean different things for different CBOs. So for Latch, we really made sure that we invested in being ready to expand our internal capacity. So that included focusing on training opportunities that offer doula training, that we're hoping now to offer community health worker training. So not only are we hoping to expand workforce capacity, that we're building our internal capacity to hopefully allow those trainees to have an work opportunity once they complete their training. We've developed data systems so that we're tracking impact. So something that we try to do with all of our partners is track quarterly impact so that we're able to come back to our partners and say, hey, this is how much we've been able to make an impact this quarter. If it's a referral partner, this is how many referrals we've been able to receive, how many we've connected with, just so that they also know that not only you're staying on top of the referrals, but that the clients are coming back. And then also ensuring compliancy with privacy laws. That was a big thing for once you start getting involved with some of the MCO internal processes, they really are looking to make sure that you're following HIPAA and that you have certain things in place to make sure we're not violating any privacy concerns that might come up. So making sure that when opportunity knocks, you're ready, at least in those areas, if you can become contract ready in those areas. But next slide. But when you think about contracting, it doesn't have to be that complicated. It can start as simple as a referral system, and you'll have a referral agreement to helping each other in a certain service area, or maybe the MCO is having a higher number of members requesting something and you are already offering that. You can put yourself maybe in the front to say, we're able to support more of that service for that, for your members right now. Like the Care Partner program, if there are MCOs that are piloting programs, being able to raise your hand and say, hey, yes, we're interested. But whatever pathway you choose to take, it takes time. So just strengthening the relationship with the MCO for long-term stability, that's really what the goal is here. Next slide. So our partnership with Community First, it's an example of what's possible when we really combine the mission-driven work with the strategic planning and the operational readiness. And like Jessica mentioned, this relationship has been growing for the past 3 years. So if you are trying to get in front of an MCO, my recommendation is just don't take the no as a discouragement or to discourage you from trying, but more of it's just a not yet and just wait. But keep showing up to where the opportunities are, because when the opportunities do come, you want to be ready and have the infrastructure to support in whatever capacity that MCO is looking for. So yeah, now I'll turn it back over to you, Charles.
Thank you both. I really enjoyed hearing about just the natural progression and kind of the organic growth of the relationship and the collaboration you have. For our listeners, please drop your questions into the chat or raise your hand. I'll keep an eye out for that. There were a couple that we had received already. This first one is, what is the best way for a community organization to partner with a MCO, even when the CBO is small in size? Jessica, do you have a feel for that?
Yeah, so as I mentioned in my presentation, but I want to reiterate that this partnership with Latch Support bloomed over a 3-year period. It took time. The first step is to outreach to an MCO. Timing is everything. So I think Veronica mentioned this. If they say no or they don't show interest immediately, it's not no forever. It's just it's not right now. And so we serve members on a spectrum of resources and health issues. And so you as an MCO or you as the CBO, I'm sorry, need to find your niche and show how you can fill it. And so whether that is for, hey, I can help with member retention, I can help with engagement, I can help in this resources, I provide this good. You just need to show us what you can do. And sometimes, again, timing is everything. So while we may be interested in what you can provide, we may not have the resources or time to direct at that second. But again, it doesn't mean it's forever.
Great. And that's kind of from the perspective of the CBO reaching out to you. But Jessica, if you have like a new need arising and you don't already have an established partner, what's your process look like of finding, a partner out there?
Yeah. And so you're saying, how does Community First find new partnerships?
Yeah.
Yeah. So we do that two ways. So one way is that we have community-based organizations reaching out to us, either through our population health management team or corporate communications team who are all already out in the field doing work and not, I don't want to say like member work, right? They're just out there meeting people and networking. So we have individuals reaching out that way. And then again, us, right? Our members are saying, hey, I need this thing. We go through our index or our partnership list and say, oh gosh, that is a need. I don't have someone who does X, Y, and Z. And so we're then looking for something. Again, timing, House Bill 1575 comes out. We, as the MCO, are now charged to look at pregnant members and assess their non-medical needs in the areas of housing, transportation, food, and childcare. So we start looking, what do our pregnant members typically need? They need diapers, they need food, they need clothing, they need assistance with utilities. Who does that? And does that MCO or CBO, I'm sorry, have not only enough resources, the funding and the capabilities to take so many members? So that is really, again, something that we look at when we're looking for a new partnership.
Thank you. I see Zoe added an item to the chat. Zoe, do you want to just unmute and ask your question?
Sure. I was just wondering if you could talk a little bit about, I know you mentioned MCOs are more focused on outcomes measures right now. And so a question for both of you of how you think about which outcomes measures are most meaningful and kind of the process for working with a CBO to set up data tracking for that, I think would be helpful to dig into. Thank you.
Yeah. Veronica, I saw you came off mute. Do you want to go ahead and answer that?
Yeah, I'll start first. So for Latch, I think it was a natural relationship just because we were already tracking certain outcomes that we knew affected maternal morbidity and mortality. And we were already tracking maternal outcomes and infant outcomes. So what ended up happening too is when we were providing services at our intake, we would also ask our clients what insurance they had. So we were able to see what MCO most of our clients were coming from. So I think once we got to the table and were able to have a conversation about what other opportunities there were to support each other, it first started with pregnant women because we were attending their community baby showers and we asked for support to support our community baby showers. So our outcomes were around pregnancy. How do we make sure that women are having a healthy pregnancy? They're making it to term. How do we reduce the chances of C-section, or how many of the clients are identifying postpartum complications? So we had already similar outcomes that we were watching, and then we just kind of focused on which ones together are we both tracking the outcomes so it can be a reportable measure between the two of us for partnership.
Yeah, and Zoe, just to piggyback off of what she said, you asked, how did Latch find out health outcome measures? While our relationship was seamless, all of us MCOs in Texas, we're following HHSC guidelines, Health and Human Services, or we're following CMS guidelines. And so when either of those two entities bring out a bill or some sort of federal guideline, the MCOs are following those guidelines, are following what they're instructing us to do. So that is one way, just, following those two organizations and kind of seeing, okay, what's the latest, what's going on. What process are we using for collecting data? We're using a third-party vendor or referral platform, and so that is how our two organizations are communicating on the referral and loop closure side.
Thank you.
Mhm.
Just on that last point that Jessica was making with data sharing, Veronica, on your side of the relationship, how is the data kind of entry and management for your organization?
Yeah, so we have internal factors that are systems that we have a state system with HHSC as well. So there's certain metrics and things that they're asking of us to track for our clients that we're serving. And then within that, there are also other metrics that we've included through intake, surveys, referral forms, that other outcomes that other funders may be asking us to. So I think it's a lot of data, it's a lot of data points, and it's always a lot to share. But I think a lot of it is we have systems in place with our intake forms and our referral forms to collect the data and then analyze it to see if we're actually meeting the need, and doing a lot of survey evaluation with clients to ask them, they came in for service, was the service that was provided actually useful for them?
Great. Well, I know probably most of us on this call all like to have that data so we can create those visuals and understand what's happening, but it does come at a cost. And it sounds like you're kind of managing a couple different platforms and sources. So as a CBO, like how do you make sure you've got these data processes and systems set up? Do you contract out for that? Do you do it internally? What's that look like?
Yeah, it is very costly. We've been very fortunate to use resources like Catch a Fire. I don't know if there are CBOs that are familiar with that, but Catch a Fire, it's a volunteer platform where professionals are able to volunteer their time. So we put projects up there like our end of the year, our impact reports, or our quarterly report, and we ask an evaluator to look at it for us and see if there are touch points that we're missing. Are we collecting enough data here? Can we shorten this and still be able to have the same reportable impact? So I think that's how we keep our costs lower when we're trying to just internally manage all of our data, all of our spreadsheets. And I'm not going to say that we still have it like 100%. We have data everywhere. I keep being told that too much data is it's a great problem to have. But it can also be really overwhelming. But that's how, at least one of the things that we do to try to keep the costs low. If there's a program that we're focusing on and trying to at least find a starting point or a finish point to see if we're on the right track with our current data evaluation.
Thank you. Another thing that came to mind, Veronica, you were explaining the value of being contract ready, and it sounds like kind of an upfront cost that you're bearing before you really know if something's going to work out. And I know you also mentioned about just your CBOs are used to running on lean budgets. So how do you kind of justify that contract ready, or like how much effort and money or time is that taken to be contract ready?
We really sat down and decided what is most important for us as far as, is our staff at the capacity? If we were to start a relationship for a referral partnership, are we at the capacity to serve currently what we're serving? And if yes, okay, then now if there is a partner or a CBO or another CBO we're trying to reach, or MCO, let's now reach out to them to see if we can now add another additional referral partner. So it really is dependent on current capacity. If we are able to even accept referrals, it's great to have a waiting list, but you don't want to have a waiting list. You want to be able to actively support referrals as they come in, and we're at a point where we are able to satisfy them as they come in. But turnover happens, shifts in funding happens, programs come to an end. Your volunteer windows it's revolving. So a lot of it comes down to, do you have the staff capacity? And if you don't right now, what does it look like to budget an additional person that's in that space that would essentially be able to not only help the current capacity of the organization, but increase it? And if you aren't in that space, it's just another space for funding opportunity to say, hey, we're really busy. We have more partners coming to us asking us for service, but we don't have the capacity yet with staffing, and we need more staff so that we can serve the community. So that I would say that's probably where we kind of really evaluate, are we contract ready first? Do we have the capacity internally to do this?
And since you were kind of talking about workforce issues, now that we're, at this place post-COVID, how is it for hiring for the type of workforce that you need?
Yeah, that's a good question. So I think so there's two rims that we're really trying to continue to build our organization out with, and one of them is with community health workers. A lot of community health workers were federally funded through a lot of organizations under COVID funding. So now a lot of COVID funding has come to an end, but how do you reestablish the importance of community health workers in the organizations and how they can help in all these different areas, whether it is client navigation, educators, intake. Community health workers have they're a huge asset to the work that we're doing. So when you think about workforce, increasing that capacity, it's how do we have spaces where those community health workers can be fitted in to grow your staff capacity, or if you're finding that you're having a lot of people coming looking for employment opportunities, should I partner with somebody to offer a CHW training or a doula training so I can eventually hire these people on to expand my service line?
Okay, great, thank you. I see a hand raised, Joel Young. Do you want to unmute yourself and ask your question?
Yes, can you hear me?
Yes.
Okay, great. And let me try and lower my hand now. Okay, awesome. Thanks, Charles. Thanks, Jessica and Veronica. That was an awesome presentation. I'm with Texas Health and Human Services and work a lot on leading the implementation for House Bill 1575. So it's very exciting to hear some of this more specific work that's kind of what we hope comes out of things like this. I was just curious if y'all had any perspectives or comments about I guess the approach of, in the case of Latched, it seems like you all do a variety of services and can kind of handle a variety of non-medical needs, which is probably in some ways has its advantages for it being like one CBO that can address multiple needs for the target population of pregnant members, versus maybe there could have been another approach of finding individual CBOs that maybe specialize per need or something like that. And so I'm just curious if that ever came up, or what that could look like, if that makes sense. So maybe like specialized non-medical services versus finding a partner that maybe is able to cover multiple needs, but is still the same target population.
Yeah, so if you don't mind, Veronica, I'm going to just jump on this, and if you have anything to add, please do. But that's a good question. So at the end of my presentation, you heard me talk about the Care Partner Program. What Community First did was we looked at House Bill 75 and said, these are the needs that we foresee are going to be some of the biggest needs, right? And you guys did a good job in really narrowing down four priorities we were focusing on. Again, that food insecurity, housing stability, childcare, and transportation. And so we then said, okay, let's look at an organization that covers multiple needs, which we found was Latched. We have an organization that just focuses on utilities. One of the things we kept seeing was that while our members had a steady place to live, it was really those utilities that they needed more specific help on. And so we found an organization that helps adults, families, with those utility needs. Again, we partnered with our local food bank who will do a lot of food interventions to get a family towards food security. So we did both in that care partner program, and we really wanted to incentivize our partners to care for our members and show us what that looked like, so that in a year and a half, we can say, okay, this is what our members needed, right? They were saying they do need food, they do need housing, they do need X, Y, and Z. And come a year later, we can find out that those needs have been covered, they're on a better path, or here is the health outcome. So I can talk more offline with you if you'd like, just to learn more about what we're doing. But we did both of those things.
Thank you.
Yeah.
And I guess what I've seen in the data is many times a member will, have multiple needs and not just one. So it seems like that would be a case where it'd be nice if that member could go to one place to get the multiple things done instead of kind of connect with different entities. I see there's another question here. Ashley Green. Ashley, do you want to unmute and ask your question?
Sure. This is specifically geared towards Veronica and Latched support. Does Latched offer opportunities to train other CBOs with doula training? And if so, can you speak more about this and its benefits?
Yeah, so our doula training, it's a 56-hour training. It's 7 different modules of education that really focuses on training the lay person in understanding what a doula is, what the scope of a doula is, and then how do you educate a mom and become that educator for her, whether it's through managing a healthy pregnancy, breastfeeding, what to expect during the postpartum period, and then of course preparing for that childbirth readiness. So if a CBO is interested in offering doula training to their current community health workers, we really do think that dual certification is such the way to go if you are focusing on serving pregnant clients. I feel like CHWs have a great understanding how to do the client navigation, but adding that extra layer of knowledge of doula and the scope of a doula, it now gives them the hospital foundational understanding, or wherever that mom is delivering, how to help her navigate through her pregnancy, birth, and then postpartum period. So yes, if there are CBOs that are interested in learning more about our doula training, we offer it virtually or in person. We're getting ready to do one in Bastrop in August, so we're super excited for that one. But yeah, just please reach out and we can share more information.
Any other last questions? If anybody wants to just unmute and or raise your hand so we can recognize you. All right, seeing none, I want to thank our speakers for sharing this story. I can tell you that this was a story that kind of came to us. We were asked to present on this topic because we were hearing that a lot of CBOs are really interested in how these relationships occur. So I really appreciate the candor that Jessica and Veronica used in sharing like just how this happened. I think it's very instructive and rewarding to hear. Before we wrap up, I just want to make our invitation. If you're a healthcare organization and you address non-medical needs either internally or through a collaboration with a community-based organization, we would love to have your work represented in our program index. This is our repository of programs around the state, and it allows you to showcase, in what ways you're already addressing non-medical needs of patients. It's a resource for providers to learn about what's going on for patient populations. And it's also valuable in our interactions with policymakers so they can see, how much of this work is occurring around the state and in their districts. The program index is only as robust as we make it. So I look forward to hearing from each of you. A link to the program index will be added to the chat. And you can also reach out to our program manager, Jackie, who started our call today. Her email address is jk90@rice.edu. Thank you very much for the time you took today to join us. Look out for meeting materials in the coming days, and we'll also include a link that allows you to give us some feedback about this seminar. This recording will be available on our website, and we encourage you to please share it with your friends and colleagues. And with that, I will wrap us up. Have a great day, everybody.